British Prime Minister Boris Johnson has unveiled plans to lift most COVID-19 restrictions in 2 weeks. People in England will not be legally required to wear face masks or maintain social distancing from July the 19th. The rules do not affect Scotland, Wales and Northern Ireland, which have their own health guidelines. The Prime Minister says the country will learn to live with the virus. The highly contagious Delta variant has led to a spike in infections in recent weeks, despite a high vaccination rate.
So as we come to the fourth step, we have to balance the risks. The risks of the disease, which the vaccines have reduced but very far from eliminated, and the risks of continuing with legally enforced restrictions that inevitably take their toll on people's lives and livelihoods, on people's health and mental health. And we must be honest with ourselves that if we can't reopen our society in the next few weeks, when we will be helped by the arrival of summer and by the school holidays, then we must ask ourselves, when will we be able to return to normal?
Let's talk now to Sonia Gallego. She's live from London. How are people reacting then to this news of a lifting of restrictions coming?
Well, it's interesting, Sami, because when I was out talking to people just today, asking about their points of view, what do they feel comfortable with, a lot of people, in fact, more often than not, were actually a bit reticent to get rid of the masks so soon, feeling perhaps a little uncomfortable with the idea of that after nearly a year and a half of having to live with these restrictions. Because, of course, as you mentioned, the Delta variant cases are rising. They've risen by some 74% in the last week alone. There have been also some gradual rise in hospitalizations as well, certainly not to the extent that we saw earlier on in the year, but nevertheless, figures that are troubling enough for the British Medical Association and other people in the medical community to question the decision that Prime Minister Boris Johnson is making. But to underline what he said, though, the final go-ahead will take place on the 12th of July. And, of course, taking into consideration all the information that will be available at that point. But for a Prime Minister that has said who would always be driven by the data and not dates, this is quite troubling for the medical community because, of course, the one section of society that is going to be most affected by this, as well as children. Now, children have not been vaccinated, and also people who are immunocompromised as well have also not been able to take advantage of the vaccine program as well. They are the ones that are most at risk. That's also where the Delta variant is sweeping fastest among that group as well. So in all considerations taken place, they have to sort of question exactly why the Prime Minister is moving ahead so fast. And perhaps what's needed really is caution at this stage, not to throw away all the good work of the vaccination program and avoid Britain or England becoming somewhat of a petri dish for new variants to pop up and therefore complicating any possible wave that could take place, as well as an influenza stage as well later on in the year.
All right, thanks so much. Sonia Gallego there. Well, the reopening had been pushed back a month from the 18th of June because of that rise in cases. Let's take a closer look at the situation since then. On the 5th of June, the UK recorded almost 6,000 cases. That compares to more than 27,000 this Monday. The Prime Minister says it could hit 50,000 a day by the reopening on the 19th. And as we mentioned, there won't be a legal requirement to wear a mask indoors in England from the 19th. That's despite studies showing wearing a mask protects other people greatly and reduces the risk of passing on the virus. The WHO is advising even fully vaccinated people to keep wearing them to prevent a chain of transmission. But the UK has been ramping up its vaccination efforts. About 86% have had a first dose and 64% have had both jabs. The government's medical advisors say vaccines weaken the link between infections and hospitalization. Let's talk to Dr. Bharat Panchanya. He's a senior clinical lecturer at the University of Exeter's Medical School and an expert in infectious disease control. He joins us on Skype from Bath. Good to have you with us. So is the UK rushing things, lifting restrictions too soon? What do you think?
I think so. And as your previous report clearly indicated, that there is a following of the date rather than the data, which is very unfortunate. So we have a Delta variant, which is much more infectious, and we've got evidence from Israel indicating that the Delta variant's efficacy against the vaccines is decreasing a little bit, and therefore we need to continue with precautions, especially in indoor crowded places where we need to wear masks to protect ourselves and protect others, and to remove this restriction, I think, is a mistake.
So why then is the UK government following this path then? I mean, is there any scientific basis for this thinking? Say, hey, let's even get rid of face masks while cases are going up?
I can't see of any reason, especially as we've got to admit and accept that this is aerosol spread. And as it is aerosol spread, we've got to have better ventilation, better protection of that virus coming and hitting us and infecting us, and we wear it to protect others as well. So it doesn't make sense. And the other element that doesn't make sense, also covered in your report just now, was immunization of the younger age group, because we all know the infections start in that younger schools, colleges age group, and then go on to the older age groups, and then the older people who are not immune or partially immune end up in hospitals. So we're entering tricky territory. Time will tell how this pans out.
How effective are vaccines administered in the UK proving against the new variants?
So at the moment, the hospital admissions are not in proportion to the rising number of cases, which is a good thing. So that's clearly indicating that the vaccines are protective. But what we want to know is, are they truly protective against also a delay in ending up in hospitals? So we normally look at a 3-week delay. And because we've got a Delta variant, slightly different variant, we need to look at maybe a 6-week interval, which we will know very soon whether the vaccines are truly protecting against being admitted to hospital and being seriously ill.
All right. Thank you very much for your thoughts, Dr. Baharat there.
Thank you.